Hello, everybody. Thanks for joining us. For those of you who don't know me, my name is Peter Llewellyn, and I run the various services around MedComms information services and activities for the global MedComms community, by which I mean medical communications, medical education, medical publishing, people who work in and around those businesses, or indeed people who want to come and join the business. And we run these weekly webinars covering all sorts of topics with panelists and speakers and so on. Today, I'm absolutely delighted that we're joined by four experienced and senior leaders from the industry who will introduce themselves in a moment. For anybody who's interested in this activity, you'll find lots of information at medcommsnetworking.com. You'll find these webinars, the program details are there, but you'll find the recordings wherever possible of the webinars that we run at NetworkPharma TV, where you'll now find nearly 300 videos of one sort or another. So there's quite a good resource building up there. Okay, so that's my little plug for myself. But again, I'd like to just say hello to Jane, Alice, Chris and Dennis, who are joining us. I'm not going to try and introduce you. I've asked you to introduce yourself properly rather than me get it wrong. So I'm going to go in alphabetical order as always. Alice, over to you to introduce yourself. Thank you very much.
Thank you, Peter, and thank you for the invitation. Really happy to be here amongst such esteemed company. So great to be here. So intro to me, my name's Alice Choi. I'm the Chief Operating Officer of McCann Health Medical Communications. So we're about a 500-person strong agency headquartered in sunny Macclesfield, but with offices across the UK, US and Canada. So I've been in MedComms for over 25 years now, started my career, as many of you have, very scientific route, started off in pharmacology, did my master's and PhD, but then I kind of flipped and very much went down the client service and commercial route, and that's where I have spent the bulk of my career in MedComms. So that's my career in a little whistle-stop tour. I do some extracurricular stuff. So like Chris, I'm a previous chair of ISMAP, another organisation that many of you will be familiar with. And I'm currently chairing the Healthcare Communications Association. And Peter, you've kindly arranged for another slot for us to tell you a little bit more about that organisation. And I try and do a lot of stuff for the community. I'm a governor at the Christie and mentor and assessor for Cancer Research UK as well. So just in terms of personal factoids, I'm the mother of 3 feisty daughters and also 3 feral dogs, which I'm really hoping you won't be hearing during the course of this call. And another factoid or near factoid, I'm pretty sure that my daughters are single-handedly responsible for half of the consumption of fake tanning products in the country. So that's an intro to me. Nice to be here.
Excellent. Okay, thank you. Thank you, Alice. I'm going to go in alphabetical order. So if I've got this right, Dennis, you're next.
Yeah. Hi, everyone. Great to be part of this. Nice to see you all again. Dennis O'Brien. I am the co-founder and CEO of Lucid. I studied pharmacology too, Alice, probably not as well as you, and then went for a career in pharma and spent 13 years in pharma. For those of you that have worked in pharma in those 13 years, you kind of get 13 different jobs. Mine were kind of focused around commercial, sales, marketing in a variety of different capacities. And then 13 years ago, Jan and I founded Lucid, and we've been on one hell of a ride over the last 14 years. There's now about 250 of us across the UK and the US. We set it up because we felt as though we could make a difference. We felt as though we could make a meaningful difference and a contribution to healthcare through communications and through strategic communications. We've been very proud of what we've done. You know, we were one of the first, if not the first, to introduce behavior change into medical communications, and really enjoyed learning and expanding that and challenging our clients. And we continue on that journey. We continue on that journey now to try and continue to demonstrate that the work that we do with our clients not only changes behavior, but ultimately improves long-term outcomes. Factoids, I'll carry the theme on, Alice. Divorced, 2 kids, 12 and 10, both homeschooling, both melting. I'm trying to manage it as best as I possibly can.
Okay, excellent. Thank you, Dennis. And continuing the alphabetical order. So Jane, you're next.
Thanks, Peter. So I'm Jane Smith, and I'm a director at AMICULUM. A little bit of background about AMICULUM. It's an independent healthcare communications and consulting business. We're celebrating our 20th anniversary this year. The company is made up of a variety of different specialist agencies and teams. And we've got close to 280 people now worldwide across 13 different locations. So a little bit like Dennis was saying, it's been a very exciting journey over the last few years. Business is growing an awful lot as well. My role within AMICULUM is to oversee the agency operations both in the UK and in the US. And I got into medical communications a little bit like by accident, like a few people. I started off my career in medical publications and scientific publishing. And my first role in MedComms was as an editor. I then moved into publications management and then on the commercial side through to the role that I play today.
Excellent. Thank you, Jane. Chris, you're next.
Well, thanks very much, Peter, and thanks everyone. Great to be with you. Yes, my name's Chris Winchester. I'm CEO of Oxford PharmaGenesis. I started out doing a degree and doctorate in biochemistry, quickly realized that the lab coat was not for me and it was time to turn my back on pipetting. I joined Oxford PharmaGenesis back in 2003 when I think there were 14 of us in one barn. And what really attracted me was that it was an independent company where you could have the chance to work with the people who were in charge. And that certainly led to no shortage of opportunity to develop and grow. And now I co-lead what's a company of nearly 400 people with 8 offices around the world. And what's been great to see is that see other people following that same path, and that our continued growth is opening up opportunities for others to develop and grow within what remains an independent company. So my factoid would be, Alice, you stole mine, 3 feisty daughters. I think I can add myself to that. And I enjoy playing the double bass. I mean, I can maybe just mention that, as Alice said, I'm a past chair of ISMAP. I'm also a co-founder of Open Pharma and an associate fellow of Green Templeton College at Oxford. So that's a little bit about me. Thanks very much.
Excellent. Thanks, everybody. I'm going to clarify just 1 or 2 points here. So, Chris, just to, because I quite liked the sort of 13 years of Lucid, the 20 years of AMICULUM. Oxford PharmaGenesis, you went in early, but when was it actually founded?
1998.
Do you know?
So what
was it 98? Was it?
Yes. Yeah.
So you're 20 plus. Okay. And Alice, just to come back to you. I mean, and the three of them have sort of emphasised the private nature of the businesses. Alice, just it's a bit of a complicated history with McCann, but just sum it up. McCann would see its roots in what year? And you're part of a much bigger communications group. Yeah?
Yeah, so our organisation is just over 30 years old now, but obviously
30, okay.
We were acquired by McCann's, and that acquisition actually happened before I joined, and I've been with the organisation, this is my 19th year now. So obviously we're a bit of a different proposition to the others on this panel, in that we're very much part of a large marketing, communications and advertising network, which I guess gives its own different set of opportunities, and obviously the McCann network extends well beyond healthcare as well. So that's the kind of overview of us.
Excellent, thanks. I just wanted to give us all a bit of a picture there, and I don't want to go any further with that. If people are interested, I would encourage them to go and Google you, Google the companies and so on. But I just I'm quite keen on the idea that, and I think it's come over quite nicely. We've got 4 experienced people, slightly different backgrounds, but 4 quite different agencies here. But a lot of experience here, 20 odd years or whatever, in, each sort of thing. I guess, over the last 20 years, things have changed a lot in MedComms. I would sum it up by saying that MedComms has matured a bit. It's become a community, it's become a business community. there's a lot of just whatever comes with maturing. I'm not quite, there was a long time ago when we were all children, MedComms was done in little agencies scattered around, not talking to each other. MedComms now there is a business community there is a cohesiveness about it. There are career opportunities, there is learning development emphasis and all the rest of it, which has been interesting to observe and be a part of. And again, I don't want us to sit here talking too much about the old days, but if you take the last year, when things have been rather disrupted and rather strange and things have moved very quickly, could each of you just give us a flavour of what's happening? I'm going to bounce around a little bit randomly here, so you all need to be on your toes here, okay, guys? Just give us a flavour of the last year in your business. What's happened? What have been the challenges? How have you dealt with some of the obvious challenges? I don't want to put words in your mouth, but just give us a flavour of what's been going on for a year or so, how doing business has changed. I'm going to bounce around. I'm going to pick Dennis first, all right?
Oh, thanks very much, Peter. So I think I can start by saying it really hit us in March. So that the COVID experience really hit us in March. And I think, the portfolio of our work is about 20-25% of our work is kind of face-to-face meetings. So, we're used to going to the congresses and advisory boards and all that sort of stuff. So we had to pivot incredibly quickly, so that was probably the single biggest challenge that we felt in April and May, is transitioning what was 20% of our business in face-to-face into virtual digital meetings. And we did it. It was an amazing achievement from the team. They committed to clients. I think we've managed to build probably stronger partnerships and stronger relationships with our clients as a result of not just supporting them through the challenge, but also seeing the dogs and the cats and the kids that they have while they've worked from home. So that's been an incredible success. I think from my perspective, we also found it tough. We love going to the office and we love being a team and we love connecting. And I think that's probably been the thing that's been most concerning for me is, managing a culture of an organization that's growing in the way that we are while you are transitioning through COVID has probably been our single biggest challenge, I think. And, we've had to make sure that we've put lots and lots and lots of things in place to make sure people feel connected, people feel communicated, people feel that we are being transparent about what we're doing. So that's probably the biggest challenge that we faced. And we now have a new journey where we've actually come through, hopefully, the majority of the COVID challenge. And we see a new world in front of us. And so now I think we're very excited about what this new world brings and what learnings we can take from what's happened in the last 9 months and then apply them to what is an exciting future and take the best of virtual and the best of digital and the best of face-to-face and create something really compelling. So that's a really exciting journey that we are on now.
Okay, excellent. Chris, I'm going to draw you in next for what it's worth. How's it been at Oxford PharmaGenesis? What challenges have you faced in terms of doing business?
Well, I think you think back to March and actually just having to switch to all working remotely overnight. And in retrospect, we were lucky. We had some disruptions to our site, the connectivity, etc., a couple of years ago, and we invested a lot so that we were in a position that literally, I think we sent a text message and said, right, tomorrow, don't come in. And we were able to switch over to working remotely. So that was a relief that the IT did bear up. Obviously, none of us have maybe had a chance to test that before, but it worked well. Then you see our clients are bearing up. They're still giving us work to do. And since then, as Dennis has talked about, it's been a very buoyant sector. And so I don't know how others feel, but sometimes a bit embarrassed to say that the issues we're facing are the issues of managing growth. Obviously, a lot of people are in a very different situation, but we're lucky to have that problem. But I think, as Dennis says, it is a problem. It's not easy to grow when you're all can be together. But when you can't read the body language about how stressed people are feeling, or it becomes more difficult, doesn't it? You can't stay connected. You can't just go around the car park, and complain about whichever idiotic situations just occurred. So that's the kind of thing I think, we're thinking about, how do we maintain the informal support networks? And I think that we did really well to begin with, and the challenge is just to maintain that as the situation has gone on. And so we've continued to introduce more things to create opportunities for people to stay connected. And with all the growth, people who've never worked with us or for us in the office, they've never been to the office, they've never met any of us face to face, and they've joined, they've been onboarded, they've been recruited and onboarded, they're doing really well, but we've never met them and make sure they feel part of our family, really.
Excellent. Okay, Jane, I'm going to pull you in. I've always thought, and I've probably had a conversation or two along the way, a company like AMICULUM, you've got offices in Australia, is it Australia or New Zealand? Sorry.
New Zealand.
It's New Zealand, China, and it must have been a little. We're all talking to you from the UK in February 2020, where we're all a bit locked down at the moment. But you sort of must have, as an international group, and I know this applies to the rest of you, must have sort of seen it sort of spreading across the world. Your offices were being sort of caught up in this before it got to you in the UK, sort of thing. Well, just give us a flavour of what maybe that was like to sort of see that coming across the world.
Yeah, it's interesting. Obviously, we have an office in Shanghai, so that was the first one affected. And they were very quickly moved to working from home, and then our other offices followed shortly after that. It was a bit of a wave after that. And since then, it's been quite a juggling act, really, to manage lots of different teams in different jurisdictions and different restrictions as well. One of the ways that we work together is we have teams all over the world who work collaboratively on projects, where they're not isolated agencies or teams. So we have team members working on an individual project who might be in different locations. Some of them are in the office some of the time, some of them are at home. It's quite a difficult balancing act, and to make everybody feel supported no matter where they're based and what restrictions they're working under. So I kind of echo what Dennis and Chris have said already. It's, hats off to the team. They have done an astounding job under the circumstances, and pretty much everybody in the business has had to learn new skills, lots of new skills, no matter which team or department you work in, not just working from home, but quickly rearranging different types of projects, moving everything online and into a virtual setting, and just the speed at which decisions have had to be made as well. It's just been an incredible effort from everybody across AMICULUM, really.
Okay, cool. And Alice, if I can throw a slightly different question at you, I'm interested in slightly different context, because you are part of this much bigger communications marketing group and so on. So I'm sort of curious how MedComms has fared, perhaps versus other areas within the group. Can you talk a bit to that? Because I would have thought MedComms has done quite well, but I would have thought some areas have suffered a little bit. Is that right?
It's exactly as Chris says. You do actually feel a prick of conscience to say that healthcare is so buoyant and we are growing so much. And when I also not just within McCann but outside, I do a lot of kind of regional work with Marketing Manchester, and we are so fortunate compared to other industries. So to Chris's point, we are hugely lucky. And I guess for me, I don't know if the others felt the same way, but last year, a kind of seminal moment for me was I was waiting to see what ASCO did, because I think if ASCO embraced the whole digital environment, then that for me was a really big positive signal that life would carry on and things would continue, and there was the opportunity for growth. And really, as Danny said, I think there's about a 2-week period in March where no one knew exactly what to expect, and it was literally like everybody went into stasis. But then after that 2-week period it was all guns blazing. So, and as James said, things that I've been very impressed with as an industry is how resilient people have been and how flexible, and we're all experiencing the same things in terms of having to take care of our people internally. But the thing that has struck me about the industry is that there have been a lot of silver linings for us, and a lot of the things we've spoken about for years, that whole digital acceleration, it's happened, it's had to happen. So I think it's a case of clearly there have been some major downers during the year, but there have been some great silver linings as well.
Excellent. Okay. So I guess the message at the moment, frankly, from all of you, which is coming over very nicely, is that frankly MedComms is doing well. It's a healthy business, and you're still growing. And you know, recruitment wise, for instance, I mean, it was very noticeable, I guess, in March that you all seem to sort of like step back a little bit. But you know, there's a lot of recruitment going on now. You all appear to be recruiting and growing actively, and I guess a lot of the recruitment is online. I think a couple of you have mentioned you've recruited people and not actually met them, sort of thing. And with that comes training and all that comes, you know, and I guess most of us would say it's nice to be in a room together and talk to each other, particularly in an early stage with the entry level types. But you know, I'm seeing a lot of very positive stories about how you're supporting staff through training and development, so on. I mean, Kathy has actually asked specifically, might have it changed? Let's just have a couple of minutes on the training and recruitment side of it. She's saying, how's it changed? Has it changed the type of applicants? What are the challenges of virtual interviews and so on? My interest is whether it's just simply opened up the talent pool, I guess, and how that works. Because if you've got an Oxford office and a Manchester office, and if your whole culture is built around having these individual little offices in different parts of the world, has it actually changed irreversibly, do you think? You see what I'm saying? And I'm going to try and bounce around a bit. So who wants to jump in on this one? Jane, you look like you're enthusiastic. So
yeah.
Say a few words.
Always
on that
enthusiastic, Peter. Yeah, I think it was happening already. I think there was a move already away from having specific offices and everybody in the office. And what we've seen in the last year is just an acceleration of what was likely to happen in the future anyway. So in the last 12 months, we've recruited a huge number of people all over the UK and our other locations as well. It's not just experienced folks. We've had entry-level writers and commercial folk join us as well. So it's not, in my view, changing the types of roles or candidates that we're advertising. It's the same approach, but everything's just done virtually instead. And then, you know, as we've talked about previously, making sure that we have a process and systems and lots of touch points with candidates before they join the company, so that they feel they're supported even before their first day, and that they're connected with people throughout their induction programs, etc. It's really difficult to replicate those little moments in the office where you might just lean over and say, I'm stuck, you know, help me with this. But we try to just put as many touch points in place as possible, different channels, you know, different people for new team members to speak to as well.
Okay, so and let's broaden this out a bit. Alice, I'm going to choose you for a moment, just and pick up a question that's come in. This idea that the talent pool is now, well, is it global? And the specific question has come in, which often comes in these discussions. Does that mean you can employ somebody if I'm based in Singapore and you're based in the UK? Why not? You know, if you can all work remotely, can I come and work for you? What's your position on that as McCann?
I suspect everyone on this panel will feel the same, but we're big advocates for flexible working. We always have been, and we feel very strongly that we want the best talent, you know, irrespective of location. So that is hugely important to us. Like Chris has said, we had invested in technology to provide really robust remote working options anyway. And like all the other guys on this panel as well, if you do global work, generally speaking, you're not tending to be in one location in any case. So people are very used to working in integrated teams irrespective of location. So that is something, that's a model that we will continue to invest in. One thing that one of my colleagues did mention to me that I thought was actually very interesting, going back to the question of recruitment and skills development and training, we are, all of us on this panel, we are going to have a cohort of people who, when the time comes when we eventually do go back on site, we are going to have a cohort of people who have never experienced, never been trained on on-site activities. So some of my colleagues are pondering, how can we best prepare them for something that they've never experienced before? And if you think about it, by now, a lot of our new starters would have had that on-site experience. So there are some funny little challenges that we've got ahead of us as well.
Can I just, I'm going to pin you, all four of you down and see if anyone wants to answer the specific question that I was trying to get at. If I'm in Singapore and you're based in the UK, can I now work for you? And I don't want to turn into a legal question, but there is a legal question in there. And I just would like to be clear with the audience. So Chris, you put your hand up, Chris, excellent. Answer that one clearly and firmly.
Well, so we've you know, to broaden it out a bit, we've got a lot of value out of being able to take people on right across the US, for instance, you know, so having people on the West Coast without needing to open an office. And maybe if we have enough people there, we could consider opening an office, but you can do it the other way around. Where are the people that you're recruiting? And maybe if they want to be in an office when we're in a position to go back to the office, that's where you set up a hub. So
okay,
that's
I think
working. But in terms of, well, to address the point, the question, so we're up for it, but in the countries where we operate, because otherwise you need to know the legal, you've got to treat people fairly and legally. You've got to set up the payroll, you've got to understand the pension and the sick leave and all sorts of employment rights. And so doing that for a single person is quite demanding. We have actually done it, and it's demanding.
Okay, no, and I'm not sorry. I was pushing that because I just wanted to hear clearly, and all of you were nodding. Okay, but that's yes. That's an important message. I think we need to get out there because we're all talking very easily about flexible working and all that comes with it. And then someone in Singapore says, "So can I work with you in the UK?" And actually, that's very challenging. And in many companies, it isn't going to happen because you're not going to take on that challenge. So I'd like to get that just very clearly out there. Sorry, I pushed that one a little bit. That's Having said that, the freelancers can sort of work anywhere, although there's admin problems and tax problems and so on. But you know, if you're a freelance, there's more flexibility. If you're an employee, it's very, very difficult, if not impossible. And I think that's an important point to get out there. Yeah. We took. Sorry, go on, Alice. Go on.
One point just to mention that is actually one of the plus points for us being part of a network, because we actually do have McCann Health offices in some of the locations that you mentioned. And Chris, I agree with what you said. There are some logistical constraints, and there are countries where you do need that infrastructure to make it a much smoother process. By the way, Peter, you're asking us for a job. You keep saying, if I were in Singapore, would you give me a job?
Hey, you can work for us in Singapore, Peter. We've got an office in Singapore. You can do it, yeah.
I've tried that before, guys, and nobody wants to give me a job. I know that. Okay, so no, I just think it's an important, because it comes up at all these things. We're talking about flexible working all the time, and I think there has to be an understanding that we are all operating in legal frameworks and whatever, and country by country things can be very different, and therefore that is an issue. Okay, having said that, if you're in the UK, for instance, if I was in the far reaches of Scotland or something like that, you know, it used to be that you had to go to Macclesfield or you had to go somewhere, whereas now that's certainly much more flexible. Just to pick up on, I'm not sure who made the point, but it led me into the question, and Dennis, I'm going to call you at this point. Do you think we've gone irretrievably down this line, and therefore it's just going to be very flexible? Let's accept maybe the UK talent pool, something. Or are you all really wanting to get back to the office, and therefore the fact that you are where you are is going to become important? We could take somebody in Scotland at the moment, but reality is we need you down the south when we open the office. Have you got a sense yet? Are you willing to say whether there's a sense of whether you've gone irretrievably down a line here or not?
Irretrievable makes it sound like a bad thing, Peter. It
feels. No, I don't. Okay, I don't see it that way. But I'm just trying to get that sort of, are we definitely going that way or not? Good or bad? I think, and maybe that's then a second discussion.
I think, you know, my personal reflections on this are that we've actually demonstrated to ourselves that we can do a great job virtually. That's fundamentally what we've demonstrated. And I feel like we've all learned a skill of how to work better with people and judge people over video. That's the experience that we've had. So I think we can create stronger teams, we can create good connections, we can work well together, we can deliver an amazing job virtually. There's no doubt about that. I think the piece that I've personally missed, I think I've missed the strategic power of being together, the creative power of being together, the innovation that we create. So I know one of the questions is just about how do you recreate office space and how do you think about office space in the future? And I think what we've got to do, and certainly what we plan to do, is to create spaces for collaboration. So just more around collaboration, less around working, more around innovation, collaboration, strategic thinking, bouncing ideas. And actually we can do the job. We can do the job wherever we are. But fundamentally that space of inspiration, creativity, that's the piece that I think we're going to really focus on in terms of office space in the future. And, you know, we're all quite excited about that.
Excellent. Okay, I think that's quite nicely put. Let's just pursue that sort of we can do the business type comment, yeah? And let's switch away a little bit from how you're managing it to doing it and for the pharma clients, or I'm going to use pharma clients as a generic term here, okay, guys, for your clients. Well, I am interested in talking and understanding and hearing about how their demands have changed in terms of, again, not what I'm getting at is, I use the conferences as an example. Obviously, it is obvious, isn't it? We've pivoted, we've gone virtual, okay, and that we can talk about. But there must be other areas and so on. So what are the clients asking you to do that maybe is a little bit different, maybe very different over the last year? Can you talk a bit to that? What are we doing for the clients? Who's going to jump in first with that one? Go on then. You're looking quizzical, Dennis. I'm going to look at you and let you take the run with that one.
Yeah.
Or is there nothing different? Is it just what we would? Because I think things are changing a lot. I don't want to put words in your mouth again, but you tell me whether things are changing at your end in terms of what you're delivering.
Yeah, well, obviously everything has moved. Everything has moved to a much better understanding of digital and a much better understanding of our target audience. And so I think what we are seeing is a much greater focus on, you know, being able to understand our audience better, being able to target our audience better, being able to create, you know, I think about customer experiences for our clients and for the communities, and create communities within this digital space that actually are empowered to make a change. So I think it's enabled communities a little bit more, Peter. It's enabled us to target a little bit better. So that's probably the biggest change that we've seen, and certainly we've got much more momentum in that space than probably we've ever had, I think.
Can I ask maybe a completely ignorant, stupid question, but I'm going to ask it anyway. Dennis, you've always made a point with Lucid of being about behavioural behavioural activity. What's the right word? Behavioural
change,
behavioural change. Yeah.
Yeah.
And I've always, that's all. That it sounds good, but it's about measuring behavioural change. Have you seen a dramatic difference over the last year or two in terms of, let's say, the last year, in terms of being able to measure that? I would have thought it opened up more possibility to measure it and to understand it.
Yeah,
but I'm not quite sure what I'm saying.
Probably. Well, I think the nature of how we measure behavior change, there's a variety of different ways that we have ultimately measured change. You can measure perception of change, and then you measure actual change. And so, it's probably enabled us to measure it easier, enabled us to measure it better. But the fundamental principles of how we're measuring it haven't really changed in that time.
But if the digitization has been accelerated, that must have opened up, like you say, to measure it more easily. Alice, you're going to jump in there, but I was just going to ask you a question, and I was picking up again on what Dennis talked about audiences. It seems to me, I'm going to say it, the patient voice, that patients have become such an important voice in what we do, and that's been accelerated dramatically over the last year, and again is partly due to the fact they've just had so much more access to stuff, and we can talk to. Can you just talk a little bit to maybe the patient side of things as maybe a new audience for MedComms, or at least new is the wrong word, but you know what I mean? It's become far more important, I think, hasn't it?
Yeah, so I'm actually going to link that in with another really huge issue that I think happened last year that we haven't really discussed. So I think what happened with Black Lives Matter and the whole spotlight, which was much needed on inequalities and so forth, has actually had implications for how and what we will deliver. So, for example, going back to that patients piece, Peter, I would say within MedComms that there is a big push, and I'm going to call it the democratization of data. So, I mean, this is something that Chris has been working hard on for a long time with open access. So I think we're going to see things like open access and things like plain language summaries. They're going to become more important because our clients are going to they're going to want to, in the right and appropriate way, be much more inclusive with their data. And I think that's a really important theme we're going to see. I think the other theme, which is actually more COVID related, is that there's going to be, well, already there are big differences in people's expectations around speed, the speed of which we're required to deliver things, the speed at which people expect to see data come out. So I think for me that the speed is going to be a big factor. And then just the final point to make, I agree with you that in theory, because we're now in a digital world, you should be able to theoretically get to those metrics much better. But just because a person is logged on to your session doesn't actually mean they're engaging with it and feeling the vibe of it. So I think there are some other challenges. And with that whole digital theme, I think the other big challenge that our clients are facing, and it's that old chestnut of differentiation. How are we going to cut through all the digital noise to make what we have to say really resonate and make it compelling? So it's a roundabout way of answering the patient piece, but I think it's kind of linked in with some other bigger issues that are going on for our clients.
Yeah.
Absolutely, and I think that's, everything is interlinked in that way. Jane, go on then. I was going to go to Chris because I thought there was a nice cue there, but Jane, you distract us. We'll go with you.
I was just going to go with the patient piece, because I think one other silver lining, I guess, from COVID, from the pandemic, is just a greater understanding of science within the public. So public awareness now of science, of clinical trials, how they're run, etc., how drugs get to market, and particularly obviously the vaccines and information around those. And I think that is going to add additional momentum behind what was already happening in our field about the kind of push for patient materials. But I think you're going to see more behind that, and also expanding that to family and caregiver materials as well, because it's so important that we get information out to everybody who's involved in care. And on the flip side, the damage that the pandemic has done, particularly in rare diseases, where a lot of scheduled visits with physicians have been cancelled because is prioritised elsewhere. There are a lot of patients who are now unfortunately in the dark about their conditions as well, and they do rely on us and the pharmaceutical companies to provide them with that education. So there's a lot more that we should be doing as an industry around patient communications.
Okay, and again, it's a much bigger question. It's just, a lot of what we're talking about highlights the fact that the communications business is important, and actually communicating information is important, and the MedComms business plays an important part in that. I was queuing up, Chris. Jane's done it. Okay, that's fine. It's just queued up.
Sorry,
so
Chris.
You're next. That's all right.
Not at all. No.
Because and let's look at the publishing side, and this is an area you're very involved with OpenPharma, and you've written recently about stuff. Tell us a little bit, how things have changed, or how things are changing, and the importance of opening up access to information through those sorts of topics.
Well, I think maybe Alice talking about the importance of inclusivity. It's important per se, but it's also important to build trust. And if we're going to have communities happy to take the drugs and vaccines that our clients are developing, they've got to feel part of it. And as Jane was saying, actually, there's a level of engagement that perhaps we haven't seen before in how our industry operates. And so that's something to build on. But that just emphasizes why we can't have all the data behind paywalls, that can only be accessed by academics or healthcare professionals who may be quite a rarefied stratum of society, and a lot of people may feel excluded from. So open access, but of course then plain language summaries, it's got to be understandable. So, you know, my learning has been maybe over the last year, plain language summaries are part of open science, you know, because we've got to not just make the things available, we've got to make them comprehensible. And I think, Jane, you mentioned speed, because speed of publication, I mean, the speed that publications have come out is amazing, but non-industry research has come out even faster as preprints. And I haven't seen pharma companies using preprints. What pharma companies are still sticking with is press releases, which they have to do legally to investors. But it doesn't seem right in this world we're in to be making changes to patient management based on press release and then having to wait for the paper. I really feel, I know there could be issues with preprints because they're not peer reviewed, but at least you've got all the data there so people can look at them. So yeah, there's all coming together, isn't it? There's increasing trust in what we're doing. The increasing engagement and understanding is driving increasing trust, and that gives us something to build on. So and we're right at the heart of that, aren't we, in helping to get information out there in a way people can understand. So
Chris, Peter, may I ask Chris a question just in terms of data release and publications and congresses?
Yes.
Just in terms of in this new world,
yes,
in terms of speed of release of information, what's your thinking on how this will evolve over the next few years, and whether we'll still be hanging out for congresses, or whether we're going to see a different world in terms of data release? Well,
that's a great question. Maybe too soon to know for sure. Obviously, abstracts are peer reviewed, you know, not to some extent, and so that gives our clients a lot of confidence. But is there some way of doing some kind of a review of preprints that would make people feel that they were safe to use? I mean, we could see a bit of convergence ultimately between publications with all these enhanced contents and author videos, and meeting activities and abstracts and posters where you can watch the video after the event. And, you know, are they going to sort of converge a bit? I think we might see something there, and maybe preprints mean that you don't have to have all the data on the poster. You know, you have the poster as a presentation aid with all the detail somewhere else. You know, that might be a vision for the future. But what do other people think?
Yeah. Well, one of the things that I'd wondered, Dennis, it's something that my colleagues and I have discussed, is whether the pandemic would lead to the death of the Congress as we know it, because if you don't need to have a big Congress and be all there in person, then you could kind of see a process whereby you could have lots of mini touch points. You know, if ASCO were to, rather than have one big bolus conference, did lots of mini touch points, and then what implications does that have for how data is released? It means that you don't have that big flurry of stuff that happens at ASCO. But as far as I can tell, I'm getting the sense from having spoken with other colleagues, not just within our organisation, but out with, it seems as though the Congress will probably live to, you know, it's going to evolve, but it will probably live in its current form, but it will maybe become more of a hybrid kind of situation. Well, perhaps some of the changes won't be as radical as first thought during the pandemic. Sorry.
Well, actually, Jane might have wanted to get in there.
I was just going to say that it's an interesting point, Dennis, and one that we've been discussing internally as well. And for all the reasons that Alice has mentioned, having that one single point when convening everybody together just seems not very logical in the current setting, does it? Having multiple different touch points would have huge benefits. It would speed up data, you know, to the audiences. It would help physicians as well, who are often overwhelmed by the amount of data released at ASCO. And as we're talking about that kind of juxtaposition of different things happening at the same time, I do wonder if we've got both an audience of physicians who are now digitally savvy and have far greater environmental and sustainability credentials than previous generations, who will be pushing for not that single congress that they travel to, but perhaps multiple different touch points where they can receive the data through other channels. So I think it's interesting. I don't know where it will land up, but it feels funny to just go back to the one congress after all of this, doesn't it?
And to be fair, we're not the only industry that has these enormous congresses and events and exhibitions. So, you know, I think we will learn from other industries on this as well.
Yeah.
My view is, I think we've got an opportunity to make the best of both worlds. You know, I love the idea that people can dial in to a symposium that's really important to them and they don't have to travel to Barcelona to do it. I also like the magic of the congresses that we create and that face-to-face interaction. So, you know, I would like to think that actually this just gives us more of an opportunity to create, you know, better, more defined customer experiences in the future. So I'm really excited about it.
In the current climate, I really want to go to Barcelona.
Just give us an excuse, Alice. Give us an excuse and we're there.
But it's interesting thinking about the multiple places, like a hub and spoke concept that could help to mitigate the environmental impact of what we do.
Yep.
There was a poster from Ipsen at ISMAP last week, and they're saying it's the transatlantic flights that kill everything. You know, so if you had half of ASCO being done in Frankfurt, then you would actually have a big environmental saving.
Yeah.
Okay, guys, I'm going to, because we could keep, this is great, and I would love to keep going, but we're going to have a problem in a moment. Well, we have a problem. We're slightly over time, which is too often the case. What I'd like to say is a huge thank you to you all. I think, I mean, on what we've just finished talking about, I couldn't get the four of you in the same room at the same time as another 120 people, as you know, like this, and have a useful conversation like this. I love this technology, but I do also think I recognize lots of the practical problems that come with it, and some of the issues we've touched on, and questions coming in about someone, Richard, saying, I just miss, you know, all the physicians are missing just talking to each other and so on. So, you know, it's a work in progress. We don't know quite yet, but it's been interesting to hear your thoughts on how things are going and how things go. For the sake of the recording, I'd like to wrap things up, if that's okay. Those of you who are watching us today, please don't disappear unless you have to. We're going to be talking to the top of the hour, so we've still got some time to carry on talking. But for the purpose of the recording, I'd like to say a huge thank you to all four of you. I know that you're all happy for me to say that people can contact you via LinkedIn. That's the easy way of doing so. So do so. If anyone's interested in what we're doing at MedComms Networking, then it's medcommsnetworking.com. We'll tell you all these sorts of activities that are going on, and these Wednesday webinars and so on and so forth. If you miss the webinars, go to NetworkPharma TV. If you're interested in getting in this business, because what you're hearing is so exciting, then go to firstmedcommsjob.com, where we've got an enormous amount of resource for you, which will hopefully explain the business and draw you in and support you and help you. So I'm going to say thank you for today. We like to finish, I don't know where this started, guys, but we're going to do it because I do it. We're going to have a little wave and say goodbye and thank you very much. So bye-bye. Everyone say bye-bye.